I'm Xavier Freixa. I'm interventional cardiologist here in the hospital clinic, and I also work in Barcelona clinic. Interventional cardiology is the specialty of cardiology that focuses on the treatment of different pathologies through catheters. With this technique, we can treat different pathologies like coronary artery disease, but currently many other conditions like valvular diseases or other congenital adult defects. Interventional cardiology is the specialty that focuses on the treatment of different cardiac conditions with the use of catheters that we introduce through the vein or through the artery. Before 2010, we mainly focused on the treatment of coronary artery disease with stents and angioplasty. But it has been after 2010 that this specialty has suffered a major revolution. Currently, we're able to treat different cardiac conditions, including all valvular disease in the aortic, mitral, tricuspid, or pulmonary valve. But not only that, we're also able to treat pathologies in the structure of the heart and many other adult congenital defects. MitraClip is a minimally invasive interventions that we apply through catheters and basically focus on restoring the correct closure of the mitral valve. The mitral valve is structured with two leaflets that sometimes can dysfunction because the valve fails after a rupture of one of the elements or dilation of the left ventricle. With the clip, we restore this natural function. MitraClip is extremely safe. Why is so safe? Because we use a vein. We don't use an artery. So the risk of having a vascular complication is very low. We don't use any dye, any contrast media, so we protect the kidneys, and we don't hurt at all the left ventricle. So it's very well tolerated in patients with dysfunction of the left ventricle. Other than MitraClip, we have different percutaneous or transcatheter mitral techniques. In Barcelona clinic, we will study your case and we will select the technique that better fits to your condition. TriClip is a minimally invasive procedure that consists in the introduction of a clip through catheters in order to restore the correct function of the tricuspid valve. The tricuspid valve is a three-leaflet structure that can dysfunction after rupture of one of the elements or dilation of the right atrium or the right ventricle. With TriClip, we seal two of these three leaflets and we restore the correct function of the valve. TriClip is effective, but after all, it's extremely safe and non-invasive. Of course, in Barcelona clinic, we have different techniques apart from TriClip for the transcatheter treatment of tricuspid valve disease. In Barcelona clinic, we will study your case and we will select the technique that better fits to your condition. Left atrial appendage occlusion, it's a technique that from my point of view will change the cardiology. Why it's going to change? Because actually it's an alternative to oral anticoagulation in patients affected of atrial fibrillation, an arrhythmia that is present in up to 20% of the population. The left atrial appendage, it's a cavity that is placed inside the left atrium. In patients with atrial fibrillation, that structure loses its contraction and can accumulate a lot of thrombus. In fact, 95% of the thrombus that are related to atrial fibrillation are placed inside this appendage. That's why we need to give oral anticoagulation to prevent that thrombus formation and to prevent the occurrence of a stroke. With left atrial appendage occlusion, we introduce a small device through catheters, through the vein, that will occlude and will prevent the formation of this thrombus. With this technique, we will protect the occurrence of a stroke while we will avoid all side effects secondary to oral anticoagulation. In our institution, we have done more than 200 procedures without any significant complications. Transaortic valve replacement is a transcatheter technique that consists of introducing an aortic valve through the femoral artery in most of the cases. Basically, it treats patients with aortic stenosis or aortic regurgitation. The main advantage of the TAVI is the rapid recovery after the intervention as compared with the conventional open surgery. The patient will be discharged after 1 or maximum 2 days if there are no complications, and the patient can start to do the normal life as soon as discharged from the hospital. Patent foramen ovale is a communication between atriums that usually closes after we're born. However, in 25% of the population, this defect stays open. It's so frequent that it can be considered a pathological condition. However, in cases that this condition associates with a stroke, it needs to be closed. Closure is extremely rapid and safe, and it's done through catheters. In Barna Clinic, we use all kinds of devices, with metal, without metal, and in the last years, with suture. Devices that don't leave any metal behind. In Barna Clinic, we will study the anatomy of the defect, and we will select the device that better adapts to this anatomy. For me, in Barna Clinic, the patient is the central focus of everything. That's why I work in a trust and confident environment, because I need to have the best of the best medical staff, the best infrastructure, and the best resources. That's why I can apply all innovation in a safe and effective environment.